We will discuss maternity disorders. They are conditions which occur during pregnancy or postpartum period. Let's start with baby blues. Its most common maternity disorder occurs in 85% of women 2 to 3 days after delivery usually, and it self-resolves in 2 weeks. And what is most common symptoms of baby blues? It's crying, mood swings, anxiety, fatigue, irritability, difficulty concentrating. Why it happens? It happens because of sudden drop of estrogens and progesterone after labor. If we imagine more severe form of baby blues is postpartum depression. It affects 20% of women after delivery. It can occur during first days or first weeks. Symptoms of postpartum depression is intense irritability, loss of interest, thought of harming oneself or baby. That's why it's important sooner intervention, because person can have thoughts harming herself or her baby. What is treatment? Treatment is antidepressants at this case, support groups, counseling, and prognosis usually is good, but treatment is needed in many cases. Preeclampsia occurs 3 to 5% of pregnant women. It's more common after 20 weeks of pregnancy and more common among first-time pregnancies when person has obesity or diabetes, multiple gestation, and age after 35. And most important characteristics of preeclampsia is high blood pressure, sudden weight gain, severe headaches, visual disturbances, protein in urine, swelling. These symptoms are because of preeclampsia. Preeclampsia have also severe form which is called eclampsia, and it characterized by seizures. So preeclampsia also requires treatment. Treatment is controlled blood pressure, for example with nifedipine. It's calcium channel blocker. Sometimes anticonvulsants also used, such as magnesium sulfate, to prevent seizures if there is risk of seizures. And fourth important disease is gestational diabetes. Gestational diabetes also occurs around 5% of pregnant women. It occurs usually in women who has obesity or overweight or age after 35, and symptoms include excessive thirst and excessive urination, fatigue, frequent infections of urinary tract infections, and blood glucose level is high. Treatment is exercise, diet, many vegetables, and fiber, dietary fibers, and sometimes insulin also needed. Prognosis here is also good. Usually after gestational period, insulin level and blood glucose level stabilize, but still gestational diabetes increase risk of diabetes later in life. That's why it's important to pay attention weight and dietary habits. Also, in case of preeclampsia, prognosis is usually good, but it also increases risk of hypertension in later life of women. That's all. It's 4 most important maternity disorders. Of course there are others also, but they are much less common. That's why I did not mention them at this case. I hope it will help you. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.